Locating credible databases and research for a clinical diagnosis. Introduction. Evidence-based practice, EBP, is the best way to provide high-quality, credible healthcare services for nurses and doctors. There are many online sources of related information, however, now, not all of them are appropriate to use. It is essential to know the relevant resources containing specific evidence-based data related to certain diagnoses and healthcare issues. Moreover, one should be able to evaluate sources of information while conducting research or dealing with a diagnosis. This paper aims to identify the importance of researching the diagnosis, describe the relevant sources and libraries, and analyze the criteria used to evaluate the usefulness of sources. Dementia is a complex diagnosis that requires elaborative research to diagnose and perform qualitative EBP. It can be the reason for nurses' uncertainty while working on dementia for the first time, and one may confuse dementia with other similar diagnoses. In this context, the focus is to provide a list of the relevant sources one may use to diagnose and deal with dementia. In addition, it is important to note the best places to conduct research within the nurse's work settings. Finally, one should identify the best communication strategies to encourage new nurses to effectively research patients' diagnoses, in this case, dementia. Communication strategies to encourage diagnosis-based research. Communication strategies to encourage research related to patient diagnosis include those that visualize the benefits of EBP for nurses. Primarily, it involves active listening and identifying verbal and nonverbal cues. In other words, one should focus on the information given by the nurse to respond and give one's arguments appropriately. In addition, it is essential to maintain nonverbal support of what was said to support one's point of view. Among the arguments provided to nurses should be those that explain the importance of conducting diagnosis-based research, namely that it is impossible to provide quality healthcare services without EBP. The strategies to collaborate with the nurses to access resources aim to make the research process easier. These involve defining each team member's objectives and assigning specific responsibilities and tasks. Certainly, the main task is to provide information to nurses about how one can access the resources within the workplace. Moreover, one should manage nurses' objectives and time to make the research process comfortable and focused. The main specific benefit of strategies in helping professional competence includes increasing healthcare services quality. It is formulated by the ratio between working environment and service provision quality, which is applied to nursing. The best places to complete the research. The best place within the work setting to complete research for nurses is the hospital's online library, which may be accessed in the nurses' workstations with computers. The Capella University Library, which may be utilized by nurses using computers, contains the relevant information related to EBP, hospital policies, and procedures. Nurses need to have free and easy access to all data sources, which may help to provide healthcare services. The types of resources that nurses should use include hospital guidelines and manuals, procedures, policies, and specific data containers related to certain healthcare issues. The reasons for utilizing the places within the healthcare setting are mainly constituted by improvement of care service provision. Thus, guidelines and manuals research contribute to appropriate healthcare procedures, and the reason to utilize hospital policy databases is formulated by the necessity to be aware of all healthcare-related aspects. Identification of 5 sources for evidence of clinical diagnosis. The best way to evaluate the credibility and usefulness of sources to use is the checklist approach. The CRAP test is one of the most widely used checklists developed by librarians at California State University. This model allows one to evaluate the relevance of resources through 5 criteria of credibility, relevance, currency, accuracy, authority, and purpose. In this regard, the 5 sources for evidence would be the PubMed website published by the National Library of Medicine and PubMed Central. Additionally, it is appropriate to use Dementia, the International Journal of Social Research and Practice by Ruth Bartlett and Elaine Wiersma, and Alzheimer's and Dementia, the Journal of the Alzheimer's Association by the Alzheimer's Association. Finally, the Alzheimer's and Dementia, Diagnosis, Assessment and Disease Monitoring, also by the Alzheimer's Association, contains credible information and guidelines for dealing with dementia. Explanation as to why the sources provide the best evidence. According to the analysis based on the CRAP model, sources have been ranked on the order of their usefulness. These sources provide the best evidence since they contain relevant, peer-reviewed full-text articles on the current diagnosis. Moreover, they involve additional data on how to monitor, diagnose, and assess the flow of dementia. Further, one may find methodologies to treat and information about possible negative outcomes and how to deal with them. As was mentioned, the criteria used to determine the relevance of resources is based on the CRAP model. Conclusion. Communication and collaboration strategies to encourage nurses to perform EBP are essential since they influence service provision quality. The best places regarding the work settings to complete research are the hospital's online library and databases on policies, manuals, and guidelines. The search process for 5 sources of online information and the criteria used to evaluate them are based on the CRAP model.